I'm Dr. Claude Khan, Clinical Lead. I'd like to talk to you today about the influenza vaccination. As you might be aware, the influenza vaccination is given every year, and it's very important to protect you against the influenza virus. This is a virus that affects the upper airways, so it can affect your throat, the nose, and the tubes, as we call it, going down to the lungs. And the reason for giving this vaccination every year is that the virus mutates, it changes slightly. So even if you had the vaccination last year, this is a question that is often asked, even if you have had the vaccination last year, there's a new influenza vaccination that is rolled out around September, October each year. And there are certain groups of people that it's very important you consider having the influenza vaccination. If you're young, you're healthy, you have a good immune system, even if you've got the flu, as we call it, you should be able to fight this infection off. But there are certain groups of people that are at high risk. So while the flu might be very mild for some people, there are groups of people that, if they get the influenza virus, can have a serious illness and even need hospitalization. Just a quick point that in the influenza vaccination is against a virus. It's not a bacteria. So many people would say, well, I can take antibiotics, but antibiotics do not work against the influenza virus. Now, if you get the influenza virus and it results in a chest infection, maybe antibiotics may have a part to play in that. But a lot of what we do in primary care should be preventative medicine. And this is an important, vaccinations are an important part of preventative therapies. So the groups of people that need to consider the influenza vaccination are those who might have a slightly compromised immune system. So certainly people over 65 are eligible for the vaccination. Even if you're healthy, you should consider the influenza vaccination. And then there are other groups, people with lung conditions like asthma, emphysema, chronic obstructive pulmonary disease, pulmonary fibrosis, cystic fibrosis, which is a slightly more rare condition. And then there are other groups, people with diabetes, which is my particular area that I'm interested in. Diabetics, type 1 or type 2, may have a compromised immune system, even if your blood sugars are well controlled. But especially if your blood sugars are not well controlled, your immune system may not be able to fight off this virus. So diabetics, asthmatics need to consider this vaccination. Some other conditions that you would need to consider having the influenza vaccination, and again, these are conditions where you might have a compromised immune system, are people with coronary artery disease. So if you've had a heart attack, or you suffer with angina, or you've had stents placed in the past, then certainly people with coronary artery disease should consider it. People with liver disease, such as cirrhosis, hepatitis. And then there are some conditions that affect your brain and your nervous system, things like Parkinson's disease, motor neuron disease, multiple sclerosis, cerebral palsy. And then there's that group of conditions we know, people with HIV, AIDS, that have a compromised immune system. Those people should particularly consider having the influenza virus. And then there are other rarer conditions where you might have had your spleen removed, people with sickle cell disease, and of course we have a lot of people who are now living in the UK and other countries with sickle cell disease. That's a big group that should consider having the influenza vaccination. One condition we often do not think about is people who are slightly overweight, with a BMI, a body mass index of over 40, because that group is again at risk, as that group was at risk with the COVID infection. That group should consider having the influenza virus. And then there's a big group of carers. If you're caring for someone, an elderly person, you need to be, while you might be able to fight off the infection, if you pick up the influenza virus, then you can spread that to the person you're caring for. And then there are the children, those who are between 2 and 3 years old are now eligible for the influenza vaccination, and the school age should be getting it at school. So in summary, the influenza vaccination is offered every year. It's extremely important as a preventative strategy. Again, I emphasize in primary care, we are not just concerned with the acute conditions when you get a chest infection. We want to prevent those things from happening. So it prevents you from having to end up in hospital over the Christmas period, the festive season. So the earlier you get that vaccination, the better. And I want to leave you with a final message that we are offering the influenza vaccination at our various practices. Our staff, they're ready to help, to listen, and to offer you appointments to get the influenza vaccination. So why not book in as soon as you can? Thank you very much.